She was diagnosed with multiple sclerosis in 1999, and she had a relapsing remitting type. It means that from time to time she had these attacks, which resulted mostly in permanent damage to her nervous system. And she started using delta laser at home, treating herself in September 2010. Her symptoms before coMra-Therapy. She had both chronic and acute pain. Chronic pain was pretty much always present. She felt radiation down the arms, legs, and face. Acute pain was in the forms of shooting and sharp shocks in hands, face, and back. She also had something called MS hug, when the pain was enveloping the abdomen, very intense pain. She experienced numbness, pins and needles, and a lot of skin pain, pain to touch. She was deaf in the left ear and blurred vision. The second most bothering aspect was fatigue. She was always tired, no energy. She had loss of muscular strength in both hands and arms. She had a great difficulty walking. She used to have a walking stick all the time. And actually, she couldn't even finish washing dishes in the kitchen. She would have to sit on a chair in order to complete the chores. She was that tired. She couldn't digest properly, and she was choking all the time with the food. She had arthritis and limited movement in the left hand. She had a coronary heart and inappropriate sinus tachycardia, high blood pressure, and very high output of bile. She used about 6 different drugs every day. Once per week, she was taking morphine for pain, and she participated in 2 different clinical trials for MS drugs. So she was under constant observation by a local hospital. This case comes from South Africa, where our representative, Charles Mitchley, he was working with this lady over the phone mostly. So how do we treat multiple sclerosis? It's a systemic disease. It's not localized in one spot, so we can put delta there. So this is a user guide, coMra-Therapy user guide, where we put together general guidelines how to approach treatment of the body. And I feel this is where the knowledge of iridology can come into place, because if you identify which organs, systems are involved in this disease, then you just open the book, you locate the place, you put delta there in that spot. I think this is a very interesting to explore. So for multiple sclerosis, we have a treatment. It's neurology 10. It's a very long treatment, 1 hour, 39 minutes. We split it into several halves, several parts. You start in the morning. You would treat, it's Universal 5, it's the name of the treatment, which addresses mostly nervous and endocrine system. So you place delta on your head, heart, sternum, and you would stimulate your adrenal glands with delta laser. So you do this first thing in the morning. Second part, very important, we do non-invasive blood irradiation with delta laser during the midday. So you put delta laser directly over each major artery of your body. So we irradiate all the volume of blood because we increase activity of the immune system, we increase oxygen carrying capacity of the blood. This treatment, Universal 3, is also very important for any infectious diseases, flus, colds, with this treatment. Midday, you treat heart. You place the delta laser on the heart from front and the back as well. Per point is usually 1 to 2 minutes. Evening after dinner. This is Universal 4. And this treatment is best for athletes, sportsmen, physical workers who have a lot of physical exhaustion. So here we focus mostly on the digestive system. Again, we treat the blood and the peripheral nervous system and the adrenals. And you also treat directly the spinal cord, because in MS, obviously, we have a loss of myelination of the nerves as well. Results. very soon, after 1 to 2 treatments, she started to feel something. It was very unusual for her. So when I summarized her diary, because you asked her to keep diary every day, apart from her clinical studies and the clinical trials. So after the first week, she was able to sleep through the night for the first time in about 10 years. No stomach pain for the first time in about 7 years. She was able to go out to do the gardening without falling over. And she worked in the kitchen without using chair. So around that time, she started to participate in a new clinical trial for a MS drug. And she developed very strong headaches and other severe symptoms. So she was very scared. What's happening to me? It could be delta laser, it could be drug. So she stopped using delta. She was very scared. But despite stopping the delta, the symptoms actually become worse and worse and worse. So after 2 weeks, she resumed treatments with delta laser, and headache subsided. Energy levels rose up again. So she, okay, so if I use delta laser, actually I improve my condition. And she continued since that time using delta laser for the last 4 years. After the first month of treatment, she stopped using all medication, all pain medication, except she still used for blood pressure and that trial drug that she was signed up for. She was, for some reason, still taking it. Day 51, she noticed whenever she put delta, her headaches would subside immediately or within a very short period of time. Her stomach pain also would disappear very soon after using the delta laser. Her arthritis of the left hand was gone, and her bile count went down by 30 points. About 3 months of treatments, she was able to handle the heat of summer months. Headaches completely stopped, no excessive fatigues, and no muscle weakness. So her improvement continued to increase. She did have several relapses during these 3 months, but we encourage you need to continue, treat yourself with delta laser, and every relapse would be shorter in time, and the magnitude of the relapse, the intensity of pain, all the symptoms would actually, every time it will be smaller and smaller and smaller. So she persisted, and she used delta laser on and on. 1 year, 4 months, she noticed she could take longer rest breaks between the treatment courses. So she would take 1 week rest periods. Now, because she was observed in this clinical trial and they did a whole battery of tests on her, bile count was normal, blood sugars, cholesterol, vitamin D, phosphorus, blood pressure, all within normal levels. A side effect, she lost weight. She had carried a lot of extra weight, and she also didn't have any craving for sugars. She was able to work full day since that time, and she resumed her exercises. She loved Pilates and yoga. 2 years, 6 months. Now, she continued a reduced program. She used delta laser for, according to program 2, 4, and 5, which is stimulation of nervous system, digestive system, and endocrine system. And she was able to take longer and longer breaks with every month. Headaches did not came back. Sometimes pain would come back, sharp pain. She would take medication for the pain to manage it, but it was very short periods of attacks. She also noticed she didn't have infections for about 2 years, although in the past she had it all the time, colds, flus, gastric infections. So she had no infections. So before the microcurrent conference, about 2 weeks ago, I asked Charles in South Africa to contact her again and get her feedback, what's going on for the last 4 years. So she wrote a big email. She felt strong, experienced no fatigue, no anxiety, no headaches. Her slurry speech and stomach problems completely disappeared. Because she was observed in hospital, they noticed improvements in psychological and cognitive testing, hand-eye coordination. All blood tests were normal, but she still suffered with her left leg, and she was still deaf in the left ear. And she maintained a reduced program during treatments in the morning and in the evening. So with delta laser, we don't just reduce pain or we manage pain. We regenerate tissue. And this is just one example, or maybe the most difficult example of regeneration of nervous tissue. But I also have other cases to present on regeneration of wounds, bones, muscle, connective tissue. And this part I just copied from her email. She now leads an extremely active life. She gets up at 6:30 all day on her feet. For the past year, I have been teaching autistic and Asperger's students cooking on a full-time basis. We are presently in search of premises to expand the business due to the demand, and also opening a production kitchen so that we can create an environment where these individuals are able to come to work each day to do something fun and interesting, earn money, and self-worth. Most of them remain at home without their adulthood, throughout their adulthood, because they're not accepted in general. So for these 4 years, we saw a transformation from someone who used chair to wash dishes to someone who is running this organization.